Hi, my name is Ashley, and today I will be showing you how to inject a subcutaneous injection. What makes this injection subcutaneous is that it is injected into the fatty layer just underneath the skin. First, you will need to get out your supplies. We have your gloves, your syringe, 2 alcohol swabs, your medication, which in this one we'll be using normal saline. In this demonstration, we'll be using a few words that you may not know. First of all, the bevel of the needle is, the tip of the needle is slightly slanted. You want that up when you go to injection. The plunger is the part that you'll pull back on. And when you do pull back, you want this side to be at the line where you draw up to. Okay, after you have washed your hands, you will want to apply your gloves. You want to apply your gloves before drawing up your medication in case some of that medication gets on your hand. You don't want it to absorb into the skin. You'll start by cleaning off the top of your vial of medication. When you see how much you're going to draw up, I'm going to draw up 10 cc's, or actually it's 0.1 cc's. You're going to draw up how much air first, however much you're going to draw up. Insert the needle straight into the vial and push the air in, just like that. Just push the plunger to push the air in. And then you're going to draw back until you reach 0.1. And you want to make sure that the needle is in the fluid when you're pulling back, because if it's a empty, a near empty vial, then you could just draw up air instead of medication. Okay, and pull that out. Then, we rarely want to recap needles, but when we have the medication and you need to cap it to get the patient ready, you do a one-handed scoop method. Okay. To do that, you will insert the needle and push down. There. That avoids you stabbing your finger. Okay. So I have a volunteer who is going to receive the injection. Stand up. Okay. I'm going to use a different needle that I haven't drawn up in, so this will just be a mock injection because he does not want to actually be injected.
No, I don't.
Who does? So we're going to get our alcohol swab. These injections can go one of 2 places. It can go in the fatty layer in the back of the arm, or in the stomach, but not within 1 inch of the belly button. We're going to go in the back of the arm. Okay. You'll just want to clean your site. And we're going to go in at a, drop down, relax. We're going to go in at a 45-degree angle, which will be just from down slightly upward. Okay. So pinch up, go in, and then you will pull back on your plunger just slightly. You're checking to see if any blood comes back into the syringe. If there is blood into the syringe, this means that you are in a vein and you need to pull out and discard and not get the injection. I don't see any blood, so I'm going to go ahead and inject and then pull out. You will then immediately discard your syringe. You do not want to try to recap this needle because this is now a dirty, contaminated needle, and you will assume that any contaminated needle is contaminated with any kind of infectious disease. So if you do not have a sharps container, then you can dispose of it in something with hard plastic like a milk jug. So we will drop that into the milk jug and apply our bandage.